Perfect. Hello, everyone. Can you see my screen? Awesome. Well, thank you so much for coming today. We are set to have a nice conversation. Really are looking forward to your input. Happy June, though I know it sometimes is feeling like we're in fall. Maybe we'll enjoy the sun for a few more than a day at some point. I think all of you by now know who, the leadership team is of the collaborative, but what's exciting for us to share is we're at 140 people signed up and counting. For today's meeting, we had 68 people registered. So I think our engagement is holding strong. So we're very happy and excited to be amongst such amazing people across the state. And that's for later. So welcome to today's session. And I just wanted to say hello. So I'll give that back to you, Scott.
Great. And I think I'm going to turn it over to David, who's going to introduce, as usual in these meetings, for those who are new, we've been having a couple projects around the state, talk about what they've been doing, and I'm going to turn it over to David to introduce them.
God, thank you very much for that. Good afternoon, folks. Really appreciate all of you taking the time out to spend, about 90 minutes with us. We're going to hear from two presenters today, Shannon Crenity, who's going to talk to us about what's happening at the Pennsylvania Perinatal Partnership. And then we're going to switch gears a little bit, and Jerea Coffey is going to talk to us about what's happening at PRISM with doula and lactation. So we'll just go ahead and jump right into our first presentation with Shannon. Shannon, you're on.
Thank you so much. Am I allowed to share?
Yes.
Okay,
go ahead and
cool.
share your slides if you.
All right, will do. It's nice to be here, and I see many familiar faces, which I love. And hold on, let's see if my computer will cooperate. Okay. So I'm here to just talk for a few minutes about the Pennsylvania Perinatal Partnership, which is a program of Access Matters. I know many of you on this call, the familiar faces that I mentioned, already know about our organization, but if you don't, I'll give a quick update. So Access Matters is a Philadelphia-based sexual and reproductive health nonprofit. Our mission is to protect, expand, and enhance equitable access to sexual and reproductive health care and information for all people, with our vision to be that every person has the health care and information they seek. We do include maternal and perinatal health under our sexual reproductive health care umbrella. I know depending on what field of public health you're in, sometimes people think of them as separate. We think of them as very intertwined. So the PPP, as we call it, I think it was founded, I don't know, 15, 20 years ago now, a long time ago, back when there used to be, I believe, a Giselle or someone might be able to pop in for more history, a requirement on some of the state maternal health grants to have grantees like talk to each other. So that was sort of what it was. It is now a collaborative group comprised of professionals, organizations, and government agencies across Pennsylvania that all work to support the health and wellness of Pennsylvanians throughout the perinatal and postpartum periods and while parenting young children. The mission of the PPP to improve health outcomes for people who are pregnant, birthing, or postpartum and their children. And we have three pillars that we kind of concentrate on: education, advocacy, and collaboration. I'm sorry, Zoom is like popping up messages for me that I don't need. 1 second. Okay, got it. So many of the member organizations of the PPP have been members for many years, decades, and most of them receive or administer federal and state funding, such as Healthy Start funding, WIC funding, Title V, maternal, infant, and early childhood home visiting, among others. These are just a handful of the PPP member organizations. Lots of city and county departments of health throughout Pennsylvania. Of course, we have members of the Pennsylvania Department of Health. Some folks who are here today come to all of our meetings and have been in communication with us. Then we have a variety of nonprofit organizations, healthcare centers, as well as some philanthropy foundations. So Maternity Care Coalition, Foundation for Delaware County, Philadelphia Health Partnership, Healthy Start Pittsburgh. We do have probably a stronger Southeastern Pennsylvania presence, but we have members across the state, and we're always looking for more partners in various parts of the state as well. So, in terms of the three pillars, training has been one of our most popular ones. Access Matters has a large training team, and we also subcontract with a lot of experts, depending on the topic. So, in the last couple of years, these are some of the topics we have covered that have gotten a lot of positive feedback. Some of them directly provided professional development per request of our PPP member organizations who work in the field of maternal and perinatal health. We've done a lot around reproductive justice and Black birthing justice, and we do have some folks on Access Matters staff who are experts in those fields. We actually years ago had a multi-year grant from the Pennsylvania Department of Health where we went across the state and did live trainings around racial microaggressions and implicit bias and perinatal health care. We've also done things like patient-centered care, motivational interviewing, vaccine safety, screening for intimate partner violence, talking to teens about sexual and reproductive health, preconception health care. We've done some great trainings on weight bias in sexual health care, which definitely impacts maternal perinatal health and managing chronic diseases that are sometimes exacerbated during those periods. We did a great session, I think, on the impact of the Dobbs decision that reversed Roe v. Wade on pregnancy care and found that some of our PP members were really thinking of abortion care as separate than pregnancy care, but we really made a lot of connections on like how abortion restrictions actually impede doctors' ability to provide pregnancy care and keep people safe during pregnancy. So this is just a highlight of some of the professional training topics that we've given in the past few years. If anyone is interested in hearing more or reaching out to get more information on these trainings, you can email us at training@accessmatters.org. Another one of our pillars is advocacy. We understand that a lot of the PPP members either don't have the capacity or don't feel like they have the ability to advocate. Maybe they're afraid of sort of like the lobbying restriction that nonprofits have. And we can actually explain what nonprofits are allowed to do if there's interest there. But we always give policy updates at our PPP meetings. We often invite guest speakers to speak on important legislative issues. For example, a couple years ago, we had a legislative assistant come and explain the elements of the Momnibus bill when that was when they were trying to get support for that. We also have offered issue advocacy toolkits. So we would pick a couple topics a year that were requested by the PPP members and develop a little toolkit that included like an overview, policy brief, as well as sample letters to the editor, social media posts. So if people wanted to increase information around intimate partner violence and maybe local resources or something, that could be one topic that we would do a toolkit around. So they have varied over the years. But again, a lot of our PPP members don't have much of a communications or advocacy team, but they still maybe want to put things on social media or they want to refer people to the resources that they have. So we try to provide some resources for that. And then, as I mentioned, we do issue education on advocacy related issues. One example, we did this maybe 3 years ago now, convened a virtual, we called it the doula panel, where we had some OBGYNs, some midwives, and some doulas. And we had a facilitated conversation on how doulas and medical professionals can work together to best support folks who are pregnant and giving birth. And I think we had about almost 100 people attend that, and people were really engaged in trying to further that issue. Some of the speakers also talked about like the policies that they set up to help to encourage and protect the role of doulas in that process. So that was a big success. And then finally, our third pillar is networking. So we do have, because everyone is spread across the state, most of our meetings are virtual, but we usually do convene once a year in person. For the most part in Harrisburg, although we're in the process of seeing, whether folks would like to rotate locations. where we do education presentations, policy updates, roundtable discussions. Sometimes we have topics and have people move around the room. Then we provide lunch and let folks just kind of network and share things that they're working on. At our quarterly virtual meetings, we again do maybe a mini training on a topic or a policy update or a guest speaker. We also allow the PPP members to promote their events. And if they need any help or if they want any collaboration, of course, there's opportunities for that. And yeah, we do have this is okay. I have a flyer that I'd be happy to share with Scott, and maybe it can be circulated about becoming a member of the Pennsylvania Perinatal Partnership. So this is just what the flyer looks like. Again, I'll send that out later. Our next PPP virtual membership meeting is Tuesday, June 24th, 11 a.m. to 12 p.m. It's just a 1 hour virtual, which is shorter than our meetings typically are. But if anyone here is thinking maybe you might want to find out more about the PPP or you might want to consider joining, feel free to email me or you can use the training at Access Matters email address. I think I'm also on the email list that we all got for this invitation. So if you want to email me directly, that's also fine. And I can forward you an invite. We've sort of taken this year to start to re-strategize what we want to do with the PPP. And I know this group has formed last year. I've recently been invited to a few other Pennsylvania-based maternal/perinatal health groups. So we're really trying to assess what each of these groups is doing and how we can complement the work or like fill in some of the gaps with the strengths that we have with the PPP. So, this is the other email address. So training at Access Matters, PPP at Access Matters, either of those myself or my staff have access to. And feel free to reach out if anyone wants more information or wants to attend the meeting. So thank you. That's it. Thank you for your time.
Fantastic. I'm going to go slightly off script here and actually encourage questions now after your presentation. Then we'll go to the next presenter with questions after that. So folks have any questions for Shannon?
I do, Shannon, about those trainings you listed, which look wonderful. I just want a two-part quick question. I wondered, what's the audience for those? I assume that it's pretty consistently healthcare providers, but I wondered if you could comment on that. And then are those sort of one-offs, or are there actually curricula and things people could request from you and use?
Mm-hmm. So through the work of the PPP, those have been one-off trainings. For the most part, there's been a couple short series. Like last year, we did a 3-part series on reproductive justice that each had like a separate focus, and we kind of circulated a flyer that said this is a 3-part series. These are the 3 trainings with the 3 dates, and you could register for all of them or just one. Um, for the most part, they're people who provide, I would say, health and social support services to folks in Pennsylvania who are pregnant, parenting, giving birth. Not always clinicians. A lot of times it's only a handful of clinicians and maybe other folks that work with those clients or in those agencies. I myself am not a clinician. I'm more of a public health sort of program administrator. I'm also a trainer by education. So we have a mix, but yeah, it would be people who are serving these clients and working in agencies or government agencies or nonprofit agencies that serve these clients.
Good stuff. Any other questions from folks?
Just a comment. Thank you so much, Shannon. I love the work you're doing. One plug I want to make is to consider including or in your announcements or things medical interpreters. So there are a few companies that provide interpretation services. I met with one this morning who's not, the ones that the big health systems use, but I think if bringing them along as well or offering the training or whenever you have summits or conferences or talks, just including them, that would be nice because often they're such a key part of the care team, but not always remembered when we're thinking about education and things. So just something to consider.
No, I love that idea. That's great. At Access Matters, we really don't provide that many direct client services ourselves. We more like convene a network of healthcare providers, and we do have some clinical folks on staff. But so we let the healthcare provider agencies sort of invite whoever they want. But I think your point is taken that it would be great to think about that as a specific audience and maybe do some direct outreach. So thank you.
And I'll share with you the contact for the company I met with this morning.
Great.
And I think they would be more than open to the opportunity.
Great, thank you. In addition to the PPP, Access Matters does a lot of trainings where if an organization wanted like their whole team trained on a certain topic, whether that's like inclusive and affirming language or racial microaggressions or doing a sexual history, we can go and sort of train the whole staff, clinicians and non-clinicians. So that's sort of like it's a related to the PPP, but it's sort of a separate service that we offer.
Interesting. Any other questions or comments that anyone has? If not, Shannon, we'll let you off the hook. Thank you very much
All right,
for
thank
spending
you.
some time with us. And at this point, we will jump to our next presenter. So, Jeray, I appreciate you taking out some time and talk to us about the work that you folks are doing.
Thank you, David. Hi, everyone. I'm Juria Coffey. I am the founder of Genesis Birth Services, which has the PRISM program, which is our nonprofit arm of Genesis Birth Services. And we are headquartered in Williamsport, PA, in North Central Pennsylvania, but we also have an office in Wilkinsburg, PA, in Southwestern Pennsylvania. That's where my roots are. And so I'm kind of trying to serve from both ends there. A little bit about the PRISM program. Our vision is to restore dignity in maternal and child health for incarcerated women and birthing people, also their families, justice involved and justice impacted families. Our approach from the PRISM program is really a holistic one in that we approach maternal health by addressing not only the needs of families through pregnancy and childbirth, but also mental health, focusing on the needs of children born to incarcerated mothers and birthing people, and caregiver support. So we focus on the needs of the families who are outside of the gate, those who are caring for the babies that have been recently born to incarcerated folks, and some of the children that have been left behind. We aim to improve access through creating a network of support to incarcerated folks and formerly incarcerated mothers and birthing people by centering respectful care, culturally humble care, and dignified care. We have several years now that I think about it. We first started in 2021 under the Wolf administration and began as a pilot program. I see Sarah Goulet in the room. So that's one of the folks that I've had the pleasure of partnering with over the years. And since that time, we had such a robust amount of interest in moms who are incarcerated enrolling in the program because it's voluntary enrollment. I find that it's better for families when we make them aware of the resources that are available to them and they come to us and we're able to meet them where they are versus a very blanket approach where we're kind of strong arming people into support that doesn't really work. And so there are some people that go through state corrections that are pregnant that don't necessarily enroll in support for their own personal reasons, but the support is always there, both in pregnancy and postpartum. And so this has been going on since 2021. The reason why the PRISM program is important is because historically, incarcerated people who are pregnant have historically been undersupported in this country. There was a PIP study, which is really the first data collection conducted regarding pregnancy and incarceration. There were about 3,000 admissions in 2016 and 2017 of pregnant people in the US prison system each year, 3,000. And there aren't many states across the country that provide in prison and in hospital doula support. And so it's really exciting that we have our program in partnership with the Department of Corrections and Department of Human Services and a few other agencies that are serving the Commonwealth of Pennsylvania to make sure that we are really filling this gap. When we think about just the maternal health crisis as a whole, sometimes people forget about the folks that are behind bars and how those circumstances, regardless of how they got there, it really can exasperate some of the symptoms that lead to our maternal health crisis. And so filling that gap has been really instrumental in seeing to it that our children in the Commonwealth are being born closer to term. We have about 90% increase in individuals who are introducing their babies in hospital to human milk through either pumping or body-to-body feeding, which means that there are more babies that are getting a healthy start and that are returning to their caregivers and to the community with the best start possible, which was something that was really important considering we started at the tail end, somewhere in the middle and tail end of the pandemic, where access to formula was a very big problem across the country, but we felt this here in Pennsylvania. And so having the opportunity for babies to really get that first, what I call immune boost that comes through colostrum, through that introduction of human milk in their first days, has been really important to the health and development, both mentally and physically, for our babies in Pennsylvania. Here recently in PA, we have launched the lactation program alongside the doula support and the mental health support that's being provided to our families. This means that since 2024, we have mothers or birthing people who are incarcerated or have recently returned home who have been able to pump their milk and have their milk shipped out to the community so that their babies are able to receive their mother or parents' milk directly, which is a huge stride for Pennsylvania, for maternal health in general. We're really excited about this because some of the feedback that we're receiving to this, even to date, is that not only does the doula support experience help these mothers or birthing people feel human, they feel seen, they're not looked at as inmate number, dot, dot, dot. They're seen as a person with a name, with a family, and they feel supported. With the lactation arm of the program and being able to provide lactation support and really that postpartum support that's needed through lactation, they're able to feel purpose while they're behind bars. They're able to connect with their children. And again, anyone in this room who, we're all here, we share a common goal, and that's the health and development of our families and our children. We understand the importance of human milk. And so while our moms and our birthing people on the incarcerated side are feeling this sense of purpose, we're seeing improvement and less instances of postpartum mood and anxiety disorders because of the purpose and the connection that they have to their children. We are also helping children with their development process. We understand the importance of breast milk, not only for gut health, but just for the brain development in itself. And so having more instances where babies are receiving human milk is another huge stride for Pennsylvania. And we're very happy to be a part of that. And our funders, such as the Jewish Healthcare Foundation, and prior to that, we had the American Academy of Pediatrics that were working with us, the Tudelman Foundation over in Philly. This is something that needs to exist. I wish it was something that was more widespread across the country, but we're really doing our best to make sure that the mothers and birthing people who are incarcerated get the support that they need. When we think about the increased, unfortunately, rates when it comes to Black maternal health, it's important for us to discuss that as well in this space. We come to understand that Black women are incarcerated 2 times the rate of white women, and so they're overrepresented in these prison spaces. That overrepresentation in prison, on top of the increased instances of Black maternal health or poor maternal health outcomes for Black and Brown people, it really kind of enhances, or really highlights rather, the importance of providing this level of support for our families in Pennsylvania. We have no shackling since 2010 in Pennsylvania. And so we're gradually taking steps, again, with the help of our legislators, with the help of, in the collaboration of the Department of Corrections and the Department of PA Human Services, we're able to not only approach policy, but we're able to approach holistic care. And I'm in a very, dare I say, a blessed position where I'm able to straddle policy, health policy, and research, and also working in the field and having that hands-on experience with supporting our families and making sure that we're reviewing policies, DOC policy, state policy, to make sure that we are identifying the best way to provide dignified care. Another area that we're providing support through the PRISM program is through reentry. We have a partnership with Grow with Google that allows us to provide training and job readiness training, both online and in person, for individuals who are looking for support with building a resume, job interview training, and identifying any skills that they may need to begin the job search process. Because unfortunately, reentry really is kind of male-centered. And so understanding the needs of a mother or a birthing person that's coming out of prison and needs to be able to provide nurture and care and support, and also financially support herself or themselves along with their children, we need to really identify what those supports are to make sure that we kind of mitigate the risk of what I call the hamster wheel, where individuals find themselves in hard times and bad decision makings, which makes them reroute back through the system again. Unfortunately, while we're building this out, I have seen people return, and that's a heartbreaking scenario, but we're able to identify, okay, what was missing? What do you need? What do we need to pull in to make sure that this doesn't happen again for you or for other people? So I'm really proud of this program, and I really thank you all for the opportunity to share a bit about the work that we're doing. It's important work, it's hard work, and we need all the support that we can get, because Pennsylvania is huge. We have a partner organization that's also doing similar work, at least at the doula support level in Erie, PA. But we have worked with Yale, Harvard, and Temple, and Howard. And we identified that what's happening here in Pennsylvania with the program is actually unprecedented when we're having this kind of triad, this 3-strand cord network of support that includes all of these different areas that are needed to address the gaps when it comes to maternal care and family care and child development. I failed to mention one thing. We also work with the Department of Health, ECCS, and are working with them when it comes to child development and really uplifting the voices of parents and caregivers, which could be anyone, to make sure that we are following the development of children as well, and expanding access to care for child development services in this area as well. So thank you.
That's some amazing stuff. I think I knew some of what you were doing, but I didn't really get the breadth of what you're doing. So really appreciate it, Drea. So in the chat, Sarah is offering up the organization that she helms. So I know you want to, I think you want to tap into that. And, the work that you're doing definitely supports maternal health, but of course, also the infants as well. And you have such it's such unique work. So it's your organization as well as the organization that you just mentioned out in Erie. Are there any other organizations doing this kind of work in the state, or just you guys?
At the level of PRISM program, no. I'm proud to say that feels weird to say, but I'm also proud that with this extensive level of care from prenatal to reentry, no. There are a few organizations across the country that, again, are looking into doula support and lactation support, but we've developed a very rare approach to maternal care, and the PRISM program is the only of its kind in Pennsylvania with that broad spectrum.
Fantastic work. Any questions, any comments from anyone else on the call?
I just had a quick question, Juria. If some groups in this group, if healthcare providers or community agencies wanted to get involved and help with what you're doing, and maybe take on some part of it in their kind of region or something, how would that work, and is there that opportunity?
That's a great question. As we expand our care and as we look further into state policy, I think one of the ways that we can look into providing care is our county jails or areas that need a lot of support. The prison program right now, because of our size and need for human power, um, we're only able to focus on the women's facilities. But the reality is that there's fatherhood engagement support that's still needed when it comes to providing support to fathers who are incarcerated, also providing support to fathers who are supporting mothers who are incarcerated. That can get very sticky, and you have to be that's a delicate matter, honestly, when you just kind of look at the dynamics, the emotional vulnerability of a man or a husband. And so we try to handle that delicately as well, and identify males who can really connect with other males to provide a level of support that a father would need. So that's one way. Also, really speaking to hospitals, hospital administration. The reality is that even though the program is based in Pittsburgh and in Williamsport, the mothers that we're serving are coming from all across Pennsylvania, which means that the children are being served all across Pennsylvania. So all of the hospitals that are represented here, you've likely cared for a child or have had a caregiver come in with a child that is not their birth child. And that's generally often what the situation is. And so identifying equitable and respectful ways of providing care to families who are not the typical, nuclear family structure, where it could be an aunt, an uncle, or a neighbor, a close family friend that's caring for a child. What type of support is needed there? Because postpartum, what we're identifying is that the postpartum support that's needed is not exclusive to the person that gave birth. Oftentimes we're having parents who have caregivers who have not given birth in 20, 30 years that now have a newborn in their care. And that's exhausting. Like I better rephrase that. I couldn't imagine having a newborn right now at this point in my life, but out of the love that people have for others, they're caring for children that they didn't give birth to. And so what type of support is needed in your community to care for families that are doing that? I think that's one of the biggest ways to expand the work across PA, is to identify who those families are and find out what their needs are, because it varies from urban to rural areas, what type of access they have. Sarah?
I just wanted to add, yeah, we're so grateful that the program exists and that we have input from like the Department of Aging too, right? So people that join our work group from aging can talk very specifically about needs for, we used to call them the grandmas, right, Julia? And we'd be like, oh, the grandmas, like the caregivers for a lot of the children, because we are fortunate and many of the women do have family caring for the children, not in every case, but they're able to really direct caregivers to understand what things might be available to them through kinship care, so they can avail themselves of other benefits and supports that they wouldn't get, or may just not be familiar that they can, right? That they might be available for other supports that can help them while they're caring for children. And it's a challenge, right? I mean, we've addressed housing, we've addressed a lot of things that have kind of come out of the needs of these caregivers and the families. And because the numbers are still thankfully relatively small, right, we're able to do this on what I always sort of call a concierge level, right? So we can really sort of like talk about the moms, Juria and the Cambridge Springs doula will say, this is what's going on, this is what they need. And we'll be like, okay, we can help figure this out. And so that's really the goal of it. So of course, we're always grateful for support from other organizations that have a way to say, hey, we might be able to do this, not to mention funding. Funding is an ongoing challenge. It's not part of a state budget. We've been fortunate to get funding at all different levels. Our most recent funding came from Child Abuse Prevention funding. We get it Office of Child Development and Early Learning and Human Services. Interestingly, that was something that was brought up to us by a member of our work group, and jury was able to give a description of the program, and they were like, okay, we can fund it out of this money, which is great. So we need more of those opportunities. Put a little plug in if anybody has any funding or any suggestions. We'd always be grateful, right, Daria? Get a little bit more money for things. But let's face it, everything comes down to, do we have funding to do it? But it's a good collaborative effort. So we're really grateful that Daria is always paying attention to like what is needed and what more can the program do.
Fantastic. Christy, I saw you had your hand up earlier. You put it back down. Has your question been answered?
Yeah, I mean, this is so great to hear about, and I just wanted to see like if there's opportunity, like at Temple. I'm at Temple Medical School now. I'm a midwife. We know each other from other stuff, but I'm like, we're trying to really build in, one, we're doing more like abolition-based kind of work, but also we're trying to build in opportunities from early and professional identity development for people to hear directly from patients, like about how these kind of programs impact their experience and things. And so I'm also just wondering if that could be like a small, like if there's opportunities to support the work, but also get the word out and directly, you know, have people who have been impacted by the PRISM program, like share with like future, you know, in health systems, like with future trainees, about it, but maybe it could be a source of getting some small amounts of funding. And then I just was curious if you guys are linked to the Still We Rise Freedom Coalition in Philly at all. One of the patient partners that I work with in Temple, like, is real involved with that, and I think would love to know more about this work. So just thinking of connections. And
I think we can connect more, you know, after the call. I don't think the organization that you mentioned is on our collaborative call yet, but again, I'm always looking for support when it comes to warm handoffs for postpartum support. And so a lot of the mothers or birthing people that we serve come from the Philadelphia area. And so the more we identify where care, either midwifery care or doula support or any other levels of community support are available in all of our counties, I think it's really helpful to be able to have as we grow our Rolodex, if you will, our web of support, knowing where these people are. I always like to say, okay, this is contact me upon release, and then I can connect you to these people, or here are some numbers for when you go home. This is who you contact. It's really helpful to do that. And so anybody that, no matter what your region is, because this is statewide, it's really, everybody can be a part of this, honestly.
And I thank you, Jerry. It's amazing work. I mean, I'm humbled to be part of this group and be able to have conversations like this and hear from what everyone is doing. And this is so important. I just want to put a plug in there for family medicine. I don't know that we're always thought about when we are thinking about maternity care. I like to say I'm amongst and I think I saw DeMarco here somewhere. We're amongst the unicorn family docs who we do the entire life course from the thought of conception to caring for the pregnancy every step of the way, delivering the baby, but then seeing that mom, the grandparents, the aunts, uncles, and the babies and the children in our office. So talk about continuity of care, talk about wrapping around patients who are often vulnerable and high risk. And seeing that person you mentioned, the elderly grandparent who is now caring for children who are in the system. I have many of those. So I just want to put a plug in to the group to really remember that family medicine obstetrics exists. And we are, talk about maternity care and child care. And so in your regions, Jerry, as you're thinking about who are the resources, think about also making your list of your family doctors, because those are the people that are really, they might have that whole family. They might have all those kids. They might, really have social services available. And they can really be partners for you and everyone doing this work.
Thank you, Dr. Ramirez.
That's my commercial for the day.
Thank you.
Good job. And thanks again, Jerea. We're going to turn it over now to Sarah, and she's going to talk to us about the maternal health strategic plan.
Thanks, David. And thanks to Julia and Shannon again for sharing information. I know we're in challenging times, and I know everyone's dealing with that. And so that the work continues and that everyone's so devoted to the work and finding ways to be able to serve the people who we know are underserved is incredibly important. So just reiterating gratitude for that. So I keep saying that I'm the girl who cried wolf every time I talk about the maternal health strategic plan, because we have not introduced it just yet. So I am gonna share my screen and give you a bit of an update. I gotta go back to the beginning. Okay, that's not the beginning. What in the world? So this is me being like a total. How do I go back? Okay, when I go back, sorry. All right, so can everybody see that first slide? Healthy moms, vibrant futures. You can see it. Somebody nod at me.
Yes, we can see it.
Okay, good. Sorry. I could see some faces, but I couldn't see anybody nodding. Okay. So, as I probably told this group before, and so I apologize to anybody who's heard it, we started planning for the maternal health strategic plan back in April of last year, and have spent a lot of time really trying to listen to people with lived experience, talk to providers, talk to virtually every potential audience we could about their maternal health needs and experiences, and worked with a lot of collaborative groups, including this one. Like, what are your goals? What are your priorities? How do they, cross, or how do they match up with ours, or what's sort of the crosswalk of those? And working again with these 4 agencies within the Health Hub. We did not include the Department of Aging because we just felt we had to sort of stop at a certain period of time. But we know that maybe down the road, we'll start to add in aging and address things such as menopause, which there's very little really research or information on, I think, as women go through that. So just an update on the plan, a quick vision statement, which I won't read, but clearly we want to make sure that I really like the short one you have, Shannon, just that everybody has access to the care they need when they want it, need it, and that it can certainly lead to long-term good health and well-being. So that vision statement has pretty much remained the same. One thing that I haven't shared before, outside of yesterday when I presented up in Scranton for one of the regional maternal health coalitions, is our goals associated with each of our priorities. So on the left are the 5 sort of OG priorities. They've been our priorities all along. And then on the right, accompanying that is a goal that really are sort of defining the priorities as a goal, and all of them with the clear directive for them to be actionable things we're going to do now, or we're going to do in this first year of the plan. So increasing access to high quality care. We want to improve perinatal outcomes by supporting access to that high quality care and ensuring that people use it. If it's available, how do they find it and use it? Supporting behavioral health and substance use needs, improving the detection of behavioral health risks during pregnancy and postpartum, and then key, improving referrals and the uptake of treatment and supports. Challenging when you do a lot of screening or you do a lot of behavioral health risks that you determine, but then if you can't get people the care they need, that's not the best outcomes for folks. Improving rural health and maternity care deserts, strengthening the resources there in rural communities. There's a lot of work already taking place around that with some of our regional rural convenings around health, of which maternal health is one aspect of those, but clearly wanting to not only know what's available in rural areas, but how do we strengthen those things and make them more readily available, more widely available as needed, in particular as we see labor and delivery units and even entire hospitals closing in some of the more rural areas of the state. Addressing social determinants of health. That's an ongoing need, and it really is a part of healthcare. So increasing awareness of and use of those supports that address health-related social needs or social determinants of health. And expanding and diversifying the maternal health workforce. So we can find That diversifying the workforce can help improve trust and better connections between patients and providers. And again, already some work underway really on all these things. But those are our main goals, which I don't think will change. Just wanted to touch on a couple of the listening session takeaways that have a impact on the goals and the recommendations. So health-related social needs. If we heard that there's an issue with transportation once, we heard it 500 times, both in our listening sessions and the survey that we did, the statewide survey. They were really a challenge for people. Even if public transportation was available, people felt they couldn't avail themselves of it, whether schedules, whether the inability to take a child, all kinds of reasons why it was tough. And so transportation is a big one. Childcare, housing, there are barriers to care and good health all through the pregnancy and postpartum period. We found that especially to be true for participants who had experienced intimate partner violence in their relationship, like getting safe housing and things such as that. We also learned from listening sessions that there's a great need to build better connections between patients and providers, which rings true and as one of our goals being expanding and diversifying that workforce. There was a lot of concern from people about treatment by providers during pregnancy. They didn't feel listened to or heard, validated, believed, and they didn't feel their concerns were addressed. That can be based on what they've told us, past treatment, experiences with discrimination or racism, and fear based on treatment of others they know. So people have told them, wasn't great, didn't have a good experience, don't bother, kind of a thing. We did hear that expressed, as you might expect, most frequently by people with physical or intellectual disabilities and the LGBTQ community. Both communities, we did specific listening sessions for them to really allow them to voice their concerns and their needs. And then improving education for women and birthing people. A lot of people said they just don't really know what they need to know. And also a lot of people would seek out resources through less than credible means, particularly like TikTok. Like, I get a lot of information from TikTok. Well, that may be good information, right? But it also could be like really bad information. So it's a matter of like, how can we work in our strategic action plan to provide credible information in ways that people want to receive it? Because better education can lead to an improved patient experience and better self-advocacy. And if we can focus that in education to specific needs so people know what questions to ask, that again can lead to increased self-advocacy and really confidence in the decisions they're making about their own health care. And increased education can result in healthier women and birthing people with better outcomes, which is certainly one of our goals and overall mission. Another thing that came out was just provider accessibility, which is very straightforward and somewhat obvious, right? There's just a lack of providers in rural communities, so people don't have care to get to, or the care is so inconvenient and so far away that they don't seek that care. So what are our next steps? Kind of where are we now? The implementation is really the primary focus of the new Maternal Health Task Force, the Perinatal Action Collaborative, which you've probably heard of and many of you are probably members of. The PAC includes stakeholders, providers, community-based orgs, and people with lived experience, and is truly tasked with helping to prioritize the recommendations and then mobilize action to implement strategies that will work to improve the health of women and postpartum individuals. PAC members are focusing on the 5 priority areas, as we looked at just a little bit ago, to really review and make any revisions to year 1 recommendations, while they're also looking at year 2 through 5 goals and recommendations. So we're providing to the PAC members our year 1 recommendations and those that we've talked about for years 2 through 5, but we're not sharing the plan just yet with everyone. So they're getting a pretty solid sneak peek so that work can begin. We have approval on those. It's just a full plan isn't approved. So we're good with letting them get started, but we're not quite ready to unveil the full plan. So the PAC's work will include determining work plans for each of the recommendations and then engaging other partners. So again, if you're not part of the PAC and want to get involved in some of that work, I think there's still an opportunity, not to presume that, Giselle, and you should stop me if I'm saying that, but I do think, we may not have all the partners we need, right? And priority teams are charged with ensuring each strategy and its implementation is specific, actionable, measurable, scalable, adaptable, and expandable. So, a pretty big task. Teams are meeting this summer with the goal of completing year one recommendations by the end of August. And that is to say, we finalized these, this is what we're going to move forward with. And we're going to be working on a lot more information about the plan on a Healthy Moms Vibrant Futures website, as well as there's a website associated with the PAC and a lot of the work around the associated grant for that. So there'll be more to come that will be posted on our website too, which will allow for it to be updated and kept obviously as current as possible. How you can help, I think, be on the lookout for the work of the PAC, and if someone does reach out to you or you are interested in getting involved and aren't already, there may be a role. So you're welcome to email me. Also, just following along with Human Services on Instagram and Facebook, we post a lot of information on there. I'm sure you could do the same for health, and I would think David or Giselle could share those social media posts too. You're also welcome to email me. There's my email. If you just have other questions about where we are or potential involvement if you're not already involved. And that's all I have today, but I'm happy to answer questions, of course.
Great. Thank you so much, Sarah.
Sure.
We have some time for questions if people have any questions about the plan or anything else. I see Mary has her hand up. Mary, do you want to unmute and ask your question?
Sorry, I was unmuted and it muted again. Thank you. Hi, Sarah. Thanks for your presentation. Is the PAC website, is that live yet?
I'm sure it's not. Giselle just confirmed
Okay.
It's not, right?
I'm sorry, can you repeat the question? I missed it.
Is the PAC website live yet?
No, it's not.
Okay, thank you.
Yep.
Any other questions? Great. Well, thank you very much. And if anybody on the group needs more information, you can reach out to Sarah, you can reach out to me, and I will connect you. We're happy to help support that effort because it looks like it's going to be really important to what's going on in the Commonwealth. To keep moving along our agenda, Michelle, are you here, Michelle Bergstein?
Yes, I am.
Great. So the next part of our agenda, we're going to hear about event coming up from Color and Culture and Latino Connection. And Michelle, do you want me to share your slides or do you want to share your slides?
Either works. If you have it ready. If not, I can share.
Okay. Well, why don't you go ahead and share if
Okay.
you got it.
Okay. One moment. Oops, I'm sharing the wrong screen. Hold on one moment.
Here, I've got him, Michelle, if you want. Oh,
Oh, can you see
there we
this?
go. Perfect. Great.
Okay, great. All right. So my name is Michelle Bergstein. I'm the senior brand manager for Color and Culture and Latino Connection. And I'm here to talk about our upcoming inaugural Pennsylvania statewide Maternal Health Summit. And our champion of mother sponsor is Highmark Whole Care. It will be on August 6th, 2025, hosted at the Lancaster Marriott at Penn Square. going to be a full day, starting from 9 to 3, with professional education. And then in the evening, we'll be having a community baby shower. So to start off, we are seeking speakers, presenters, and panelists to help build our great agenda and to help with building out the education that we hope to have for our attendance. So our short code is bit.ly /MHS 2025 CFS. I also have a QR code here. So looking for people to be part of either our morning panel, looking for speakers in the afternoon, and then we also have breakout sessions. So if you have any questions, feel free to, I believe Sean and Betsy are usually on this call. You can reach out to them or feel free to email me as well. Going along, so for some additional information, we do have a website. It is pamaternalhealthsummit.org. So this is the place where you can get additional information regarding our call for speakers. And one thing I did not mention is our call for speakers does end at midnight on June 20th. If you do need some additional time in order to get a submission in, feel free to reach out. But this is also our hub, so that way you can learn more about sponsorship opportunities, vendor opportunities, as well as some other ways in which organizations and individuals can participate. Registration is open. So as I said, sessions will highlight clinical practices, lived experiences with a focus on improving outcomes for mothers, birthing people, and families. Between now and June 20th, you have the opportunity to save $10. So the registration link is up at the top, 2025mhs.eventbrite.com. The PDF presentation will be available for people on this call, I believe. If not, I can also send that out as well. But this registration is also accessible through our website. And then last but not least, I did want to touch on this. So the evening programming that we have is a community baby shower. So opening up and making it free for the community. So for families and parents to enjoy fun activities, connect with local resources, and receive helpful information on pregnancy, parenting, and early education, childhood care. So that registration link is also on Eventbrite, 2025mhscbs.eventbrite.com. Use the code MHSCBS to unlock the tickets. And this is if you all would like to attend, that would be great. But this is more of an encouragement to share with people within your local community, patients that you see that would like to get some more accessible education about maternal health. So that's it in a nutshell. If anyone has any questions, I'm here to answer them.
Thank you, Michelle. I had a quick question. If people want to contribute to the baby shower, like I don't know what your plan is. If it's like when I think of a baby shower, I don't know if that's what you're doing, but is there an opportunity to do so? And how do we do that?
Yeah, great question. So feel free to reach out to Sean or Betsy. So what we're looking for is, so we'll have, yes, the baby shower component toward the end, which is going to be kind of like a raffle. But throughout the evening, we'll also have some like little like educational sessions. So some examples of which, like, how to properly breastfeed. Also, maybe providing some access to like doulas. Yeah. So if you would like to provide any type of resources to our community baby shower, please reach out.
And I'll go ahead and put Sean and Betsy's emails in the chat so people know. They're part of the leadership of this group, but couldn't make this meeting today. So I'll put their emails in the chat. Any other questions for Michelle? We did send out some of the materials with one of our emails to this group earlier this week, and we will post the slides and more information about the summit on the website with the recording of this meeting. But hopefully people will be able to go and submit some presentations before the deadline, and it should be a great event.
Thank you so much.
Great. And with that, I think we're moving on to talk a little bit more about this collaborative specifically. And we've had 4 really wonderful meetings. We appreciate all the participation and all the sharing about what's going on around the Commonwealth. And now we want to talk a little bit about kind of where we should go from here. I think there's obviously interest. We have a lot of people engaged, hopefully some people who weren't maybe engaged in the projects that we've been talking about, or the statewide action plan, or any of the other statewide initiatives. But so we're going to do 2 things. First, I'm going to ask Gabby to share the information about the SharePoint site. I think that was the next part of what we wanted to do that we're setting up for communication, and then turn it back to Dr. Ramirez to lead a discussion of kind of where should we go from here. So Gabby, are you ready?
Yes. One moment. So hi, everybody. I'm Gabrielle Alatis. I'm one of the interns at the Office of Health Equity, and I've been working with the collaborative since I joined the office. We've been working on creating a SharePoint site just to make everything accessible to everyone in the collaborative and just have a one-stop shop for resources, meeting information, etc. So hopefully you can see the screen, but here's the website we have so far, and it's just to once again, make things a little easier for sharing resources and information. So on the side, for example, we have documents with meeting presentations, notes, format, agendas. You can click here and it'll take you to the registration link. We have the information about the purpose, our goals. We hope to add some upcoming events. So for example, we have the Maternal Health Summit coming up that we just talked about. So you can click here, it'll take you to their website. And also just, for example, click this, you can get the member sign up. So just making it easier to share information, maybe share to maybe colleagues who are interested in the collaborative, want to know what it's about, want to have information on the meetings and so on. So hopefully we're hoping to update this and also get your input if there's things you want to see on it, if there's information you want to share for events or notes or other topics. Thank you.
Great, thank you, Gabrielle. And I think that's going to be a step up from the kind of current static web page that we've created. And we'd love to get your input if you have upcoming events, if you have patient education materials you want to share, or anything you want to put out there for the rest of the group. Just let me know, or Gabrielle, and we can help you get it up there. I think we're going to be doing some communication about how to access the SharePoint site. And it's just got set up, so we haven't communicated that to all of you yet, but we will soon, and hopefully it'll become a robust way for us to share and spread the learnings from these meetings. So great. With that, I think Dr. Ramirez, are you ready to go?
Yeah, ready. And then before I start my section, over the last few meetings and even our leadership meetings that we have more often, I have consistently been inspired by the collective passion and drive and all of the work that is happening across the state. And I think at each of our leadership meetings, I'm always left reflecting on who are we, what is our identity, and what are we really about? And I love graphic design. So the leadership team hasn't seen this, but I put together and I refined it a little bit based on what I'm just hearing today. I mean, it's exhilarating every time I'm at these meetings. So I put together a little bit like an infographic to capture a lot of who we are, what we are. It's a rough draft. I'm open to feedback, but here it is. So this is what I've put together so far. So when I think about who we are, so at the bottom is our shared mission, but we're really a catalyst for engagement and a nexus for collective impact. Like when I think about the PA Maternal Health Collaborative, I think at the top of the hour, someone had mentioned, you're getting called for all of these groups across the state, right? Everyone is doing a lot of work in maternal health. And then at some point, perhaps the PA Maternal Health Collaborative, the root and the essence of who we are and why we were born might get a little diluted or lost. So I wanted to capture that in one graphic. So we're truly a catalyst. We're truly a place where we hope that you find a think tank, a place where you can find perhaps collaborators, a place where you can have ideas shared or met, inspired by the stories that you hear. And I'm trying to do two things and see if this helps. So I can't walk and talk at the same time, right? Here we go. Here's my slide. So the other thing I made was my funnel. This is my funnel. I kept adding bubbles. I'm like, at some point, stop adding bubbles. But the bubbles represent 140 plus of us who continue to find us. So we are the funnel. And, when we think about who we are, again, we're the catalyst for engagement. We're a hub for collaboration. We're a think tank. We are a nexus for collective impact. But truly, where the power is the power of leveraging all of our expertise and really the power of the group. And so when we think about all of that and who we are and the things you've heard today, really, we want to have a conversation with you about what are our next steps as a collaborative. So we know that there are multiple statewide groups who've developed or in the process of developing frameworks and recommendations, right? We know that there are many discrete projects, we've heard of a few today, who are working to address maternal morbidity, mortality, health disparities, social determinants of health, both statewide and regionally. But our main question to you and what we want to spend some time on today is how can our collaborative help advance these efforts? So the goal is that we can have an open conversation and perhaps come up with one or two action items that we can, we can really put on the docket for how do we move forward as a collaborative? What can we do? And this is your cue to throw things out there. So truly, it's meant to be an open conversation. So what are your thoughts? So as you think about the collaborative and your membership in the collaborative, your needs, being a member in the collaborative, what are things that as a collaborative we can do to help either advance your efforts or highlight efforts that have not already been made or addressed? What are you thinking? As you're thinking, I'll share one that we heard early on with this group was the need to have a centralized place where information can be found. And that's where now the SharePoint exists. So that, was a direct answer to that request from the members of this collaborative. So just like that request, we are wanting to hear from you. So what are things that you need to help advance efforts?
I'll just add a little bit to what Sarah said about what we've heard over the 4 meetings we've held. In earlier meeting, we did do some breakout rooms and brainstorming, and there was interest in having this group help match individual needs or individual project needs with others in the group. Having people come to us and say, hey, we're doing this project. We'd really love to get more of this type of professional involved or expand into these regions and use the power of the diverse group we have to help make those connections. So I think SharePoint site can do that, but also these quarterly meetings, we're happy to kind of give time to anybody who wants to talk about something they're doing or want to do and what they might need to help get it moving. And another suggestion from that earlier discussion were to help residents, help patients, consumers, community members take ownership of their health and their rights and make sure that we're all communicating sort of the same language to them about what resources are available to them and what they should be doing. So sort of a patient or community member education coordination, but making sure we all have what we need when we interact with a patient or a client to tell them what's available to them. So those were two ideas that came up out of the earlier discussion.
Mm-hmm. Absolutely. What are some other thoughts out there?
I think like similar to what Shannon mentioned and what you all just said too, something that would be helpful in discerning the lane for this group is and maybe this already exists, but some place that lists now all these different statewide groups, like we've heard from a couple of them already today, and like it's just hard, all the acronyms and all the different groups, because we're all involved in a lot of different things. Like it'd be so helpful to have almost like a map or like a list of, like Sarah, if you're a visual person, of like, just to help. Like I love the language you used about the nexus or, the things you said there, but I'm dealing with this in this other setting around some of the academic freedom work happening at universities in this political times. And we're all like, we want to, I think no one wants to be duplicating efforts. And I think there's a need for a lot of different things, but I can just say it's hard for me to hold space without it being in one place of like
Yeah.
it just even as a start, the names and the missions of each of those things, like I think it might be helpful.
Yeah, thank you, Christy. And we hear you, and that's where the SharePoint I think was born, and that's our goal with the site. And so as time goes on, um, we will be adding to that site all of the groups like you've mentioned that are working on things. Because we know 140 plus members, we know the groups that they belong to. And as we hear of more projects, perhaps Scott and Gabby and Ken say, those can also have bubbles on the SharePoint site. But that is the long-term goal, is that, Christy, there will be a time where you can go to our site and you can look through the site and say, okay, here are the people. I want to do something. Let me click on this button and see who I need to contact to learn more about what they're doing. If that's helpful. Yeah.
Well, just to further, I mean, I think that is awesome, but I think, and I see a couple people in the chat agreeing, like just thinking less about like all the projects that we're all doing, but it just feels like in the last year or two, there's several of these like whole statewide things, and it would be.
Yeah, and they would be on there as well. There's a slide, to your point, we've started collecting some of that. So it's here is kind of where we fit in.
Yes, like that kind of thing.
Yeah. So this PowerPoint will also be on it, but we, on the SharePoint, we can do like these big overarching groups, like you said, across the state. And then within the site, create kind of other areas where people can look at more individualized folks and contacts as we go on in time. But yes, so we have this information and we can put that on the SharePoint. And Mario, you had your hand up.
Thanks, Sarah. I do agree that lots of these efforts and collaboratives started around the same time, not knowing that there were other efforts that were happening, and figuring out how to consolidate would be very helpful. And I appreciate that's what we're doing here. I do think that there's a strong representation in this particular group, maybe 140 that are part of this collaborative, that overlap with community-based organizations and primary care, providers, people that provide direct services to families, and I think that's a little bit different than primarily OBGYN or hospital groups or other organizations. And so maybe that is a strength of this particular collaborative. I mean, thinking about the leadership and who's part of it, that, really channeling the, primary care, distributed resources, community-based organizations, and creating sort of that part of the network. But what I do think, is just an observation that's missing, in our communities, and we saw, a devastating thing that happened, close to Philadelphia, the next county over, which is Crozier Hospital being shut down, and closing a maternity unit there, with no strategic plan for who was going to take over, provide perinatal services, for all of the clinical operations that fed into that hospital, creating almost a maternity care desert right next to Philadelphia County. So, if that can happen, in Delco, it can happen any place. And, we've seen in the last couple of years more and more counties losing hospitals and labor floors. And I don't think that the health systems are as plugged into the needs of patients and families in perinatal space as the 140 people that are part of this collaborative. And I wonder how we as an organization might be able to sort of, really get to that C-suite level, and let people know the type of work, resources, teams, personnel, and strategy that is needed to do better care. Because it's not just labor and delivery, right? And that's sort of what the hospital sort of sees. And I think we bring a lot of perspective, and perhaps that is a way that we could add to this conversation.
Thank you, Mario. Jeria, your hand is up as well.
Thank you. I just wanted to, I guess, either highlight or find out if anyone was also aware of a few other groups that are doing similar work, where there is likely overlap. I know I'm here. I see a couple of familiar faces from other spaces that weren't necessarily mentioned on the next slide, and that is the PAPQC and Thriving PA as well, where the work is similar. Some of the goals are similar. The process is similar. And so finding out, I think I echo, it might have been Christy, making sure that we're not squeezing the sponge dry by having so much overlap that we're having the same conversations in 5 different places. And that's a challenge because, like I mentioned before, PA is huge. And we just heard, we have right in Philadelphia County a maternal care desert. Like, what even is that? Why did that happen? And what are the efforts to address that? And then we also have our issues with rural Pennsylvania not having access to the things that they need. And I'm aware of that since we're headquartered in rural Pennsylvania as well as in an urban area. And I'm just kind of, for me, concerned about our efforts and our end goal for, like, what are we hoping to accomplish, and how is that different, or how is it the same as these other groups, and do we need to pare down, or what is the process for making sure that we're moving forward without duplicity, or even more than duplicity, whatever's bigger than duplicity.
Yeah, Jeria, thank you so much. And Mario, Christy, all those that have made comments in the chat. And I think for us, the leadership group here, we share some of those concerns too. How do we try to get the word out that we are here? Also, how do we get to know all of the things as much as we can across the state? Because Jerry, you're correct. PA is huge. And we're trying to break the silos, and we're trying to kind of centralize folks so that we're not duplicating or doing redundant work, whatever, like you said, duplicate more than that. And I think that what's helpful for us is for those of you, like you just added 2 more to our list, we can go back to our database and make sure they're included. And if not, add them. But if you're aware of groups that we've not mentioned, I mean, at some point, I'm sure Tensei, Gabby will put up there the list of the groups that are already part of the collaborative, right? And then people can look on that list. And if you see people that are missing or groups that are missing, please share that with us. Send that to Tensei, Gabby, and Scott, and we can add them to the list. Because we can't do this work without your input and your help and your expertise and knowledge. So
yeah. And that is something we haven't shared with the full group yet, and we should now that we have the SharePoint set up, so you can see the representation of the different groups. And I think to go back to Dr. DeMarco's point, one of this organization, one of the key founding groups is us, the Family Medicine Education Consortium. So we really hope to bring a lot more of the primary care providers, the health systems, the FQHCs into the work, because we kind of got the sense that sometimes for these statewide efforts, they're maybe not as at the table as they could be. So we could become a kind of a conduit for you all who are doing this great work to share that to the primary care, to the health systems, and as Mario mentioned, to the C-suite, so the people that maybe aren't going to ever come to these tables. And everybody's busy. I don't mean to imply they're busier, but they just don't have time. And so we could maybe help them understand what's going on, the critical work that's going on kind of outside the hospital, outside the clinic. I think would be important.
Yeah, and Scott, thank you for that. I think one thing we haven't done, just me reflecting, we haven't done well is highlighted the potential for advocacy. So, with my role with NHMA PA, NHMA was founded in DC, is often, writing letters to the Capitol, knocking on doors. And so how can we all in Pennsylvania kind of tie into some of that advocacy? So we'll make sure to perhaps add that to SharePoint, is how can we also advocate out on the Hill for issues that are important to us. Naya, Bria, did I say your name right? Nia? I'm sorry.
You're good. You had it right the first time. It's Naya.
Naya.
Thank
There
you.
you go.
Yeah. My name is Naya Yaruso. I'm with Maternity Care Coalition. I know we're kind of finishing up here. But you actually just touched on one of the comments I was going to make. And please bear with me, as I'm sure this thought isn't totally articulated and maybe even out of scope. But when I see this, catalyst for engagement, the hub of collaboration, nexus for collective impact, I'm thinking, where does volume actually benefit us when it seems like, there's so much happening in terms of maybe services and all of these groups trying to accomplish things. But I think in the policy and advocacy space, it can be a huge benefit and a huge strength to kind of rally all of these groups around different policy efforts, different advocacy efforts, and especially in times right now where we're not sure what funding is going to be available, what programs are going to, survive, and what we want to be is responsive to our communities. If this point of access goes away, what can you do instead? And just making sure that we're potentially sharing information and just rallying around opportunities for those advocacy efforts, and figuring out what policy levers we can, pull on as this huge group. I just think that's a potential strength.
Thank you, Nia. Yeah, so huge piece, if there are folks in this collaborative meeting right now who have involvement in organizations with a direct link to advocating on the Hill, please reach out to me, and we can schedule a meeting, with myself and HMA and then your groups. And that's something we can do and we can add. And I think for healthcare providers, it's often daunting, and we're all healthcare providers, to think about how do we take what's happening in our state and how do we literally go to the Capitol, whether it be a letter, a video, a story, or something, and take it to the Capitol and really advocate on that level. So I'm happy to start those conversations, and please email me if you are directly linked to a group who's already doing that in DC. I'm going to stop sharing. This was fantastic. I expected only 2 points. I have a whole list here, and I'm sure Scott does too, of where the next step is. So I'm going to stop sharing and give it back to Scott.
Great. Well, thank you so much, everyone. This was really helpful. I think we have some ideas to kind of play with during our leadership groups meetings that happen in between these general membership meetings. We will put out the recording and the slides and other resources from this meeting and let the full group know that they've been posted. We will promote how to use the SharePoint site shortly. And our next meeting date is tentatively set for full meeting date is tentatively set for September 5th, probably the same time, 12:30 to 2 p.m. And in the meantime, we will be communicating more to you all as we figure out exactly what the purposes of this group are going to be. And we will continue to accept people. So if there's people who maybe aren't involved and you want to refer them to the website where they can sign up, or just have them shoot an email to anyone of the leadership group, that would be great. So thank you to our presenters. Thank you to all the people on the leadership team. And we will talk to you. Hopefully we'll see some of you August 8th at the summit, and otherwise see you next time on September 5th.
Thank you,
Thank
Scott.
you.